At CST, our real service is our care center. Our care center combines some incredibly compassionate people who have been extraordinarily trained with the technology and the software we've invested heavily in to deliver that real in-time, in-the-moment service that our patients need.
The process is they would activate their button while they're in the home or wherever they are. That call would come to the care center representative. They would immediately know who the person is, what their demographics are, who their contacts are. So they would then first talk to them through their device and say, Mrs. Smith, this is Jamie with CST or Link to Life. How can I help you today? And then they would have the conversation and determine what the needs are.
We don't just get a little bit of information, we get all the information. So we get the discharge instructions from the hospital, we get the information from their primary care physician, we get the patient's information, who to call, what family members do they want called in case of an emergency or a need. By having all this information in our possession, when that patient presses their button, we have the ability to deliver a response, a directed response, an intelligent response. So right care at the right time.
Do you want me to contact your neighbor, Brian? I do have his phone number here for you.
A lot of people ask, why not just call 911 directly? What's different about CST or Link to Life is that we are much more patient focused. We are providing patient care. We are encouraging our patients to push their button for anything that you need, and you will have somebody on the other line within minutes to talk to you and help you in any way that they can.
Sometimes it is easier for us to get in contact with their nurse or their doctor specifically. The patients don't have to deal with making the call to the doctor and the call to the nurse and the call to the pharmacy. That's what we're there for.
Because we aggregate for all the stakeholders in that patient's circle, by handing them this button and having all that information access to us so we can solve all those issues for them. We can schedule their primary care physician appointment 3 days out of the hospital. We can get their medications filled for them.
We also provide a service where we do outbound calls to do a good morning call or a medication reminder call. We will also call them back after they've been discharged from the hospital and just do a how are you feeling today call.
If they don't speak English, we do have Spanish-speaking bilingual representatives in our care center. For the other languages, we actually use a language line so we can connect the patient to an interpreter for us 24 hours a day as well.
It really is a wonderful thing to know that you can provide someone that safety and security 24 hours a day, regardless of where they are, that they have someone to talk to in the event of an emergency or in the event of just needing some social reassurance and someone to talk to, a kind, friendly voice on the other end.
Patients are telling us that they have no reluctance to press their nurse call button. In the past, they would have been very reluctant to call family members at 2 o'clock in the morning. They would never have even thought about trying to call their physician after hours. They never would have done anything other than perhaps pick up the phone, dial 911, and we know what the outcome there is. They're going to end up back in the hospital and probably readmitted. We bring a practical, cost-effective solution to raise the quality of care, at the same time drive costs out.
Recibimos una alarma de emergencia. ¿Necesita ayuda?
From day one, we've attracted customers and our partners that range everywhere from the most prestigious health systems across the country to very, very big home care relationships. We have over 800 home care relationships today across the country. Those home care companies who are providing a custom branded service that we actually supply the care center services for. Our program allows them to put a program in today that will not only improve the quality of care, irrefutable, but will also reduce costs and ultimately solve at least a portion of the readmission problem.
Most of the time when patients push their button, it is just the most friendly, wonderful experience. Oftentimes they are just so grateful to talk to a kind, friendly voice on the other end.
The patients thank me every day for being there when they need emergency services or when they have a question in regard to their medication.
It is the delicate balance between a lot of technology, but doing it with the compassionate people on the front lines that make the difference at CST.